Right, so Francis, the number, of course, of confirmed COVID-19 cases in South Africa has increased by 52 to 202. We saw, of course, the minister last night at a meeting with the South African Medical Association indicating that. So we were expecting that announcement by this morning. He made, of course, that announcement in Bloemfontein today.
So that's quite a jump, something we could see in coming days, an escalation of the numbers. Let's take a look at some safety measures against coronavirus. Just to inform you, the National Institute for Communicable Diseases releasing these safety measures. One, avoid touching your face. That's how, if you pick up some of the virus and touch your face, that's how you can get infected.
All right, when greeting, just wave. I think, Francis, everybody just using the elbow as demonstrated over the past couple of weeks. I think it seems to be working very well, but trying to keep that social distance. You know, oftentimes people come in for a hug and you're like, no, you can't.
So no shaking of hands,
yes.
No kissing, no hugging at all. First step of self-quarantine. So if you suspect that you have got this illness, stay home, please. Only go out if you need medical care.
So, of course, you can only go out if you need medical care. Try staying at home for this particular period. And, of course, go out when you really absolutely need to.
Monitor your symptoms: fever, cough, shortness of breath, some of the symptoms of coronavirus. And we're taking you through these steps of self-quarantine.
Right, Francis, obviously, you know, over the past few weeks, we've been getting these tips from the National Institute for Communicable Diseases and the Department of Health. A third step you can have a look at there for self-quarantine: get medical attention as soon as possible if you become ill.
Fourth step, make sure you know and follow the steps to seeking care. So, of course, there are those hotline numbers. There are steps for you to follow, and we'll bring you those numbers again. The fifth step of self-quarantine: do not go to work, school, or public areas.
Avoid using public transportation. I know that some of you don't have any other option, but what we've seen, Francis, over the past few days, the South African National Taxi Association also indicating, playing their part. We saw quite a number of taxis being sanitized. So before they go and embark on a trip, and after that has happened. So everybody playing their part, certainly, with regard to that.
So with sixth step of self-quarantine, separate yourself from other people and even animals in your home. We know that pets can get coronavirus. If you can, use a separate bathroom as well.
If you can also use a separate room. So you could certainly use that as well. Seventh step of self-quarantine: face masks, of course, should be used to help prevent the spread of the disease to others. Francis, coughing or sneezing, you know, fold that into your arm. We've been demonstrating that for quite a while. Yeah,
so you don't spread the droplets. Alternatively, cover your mouth and nose with a tissue when you cough or sneeze. So please don't cough or sneeze openly, especially if you suspect or know that you have coronavirus.
All right, we're still going through those steps of self-quarantine. Clean your hands as often as possible with soap and water for at least 20 seconds, or with the alcohol-based hand sanitizer that contains between 60 and 95% alcohol.
And ninth step, avoid touching your eyes, nose and mouth with unwashed hands. We have one more step of self-quarantine.
All right, the last step, and I hope you took away quite a lot from that. So clean surfaces like your counters, your tabletops, doorknobs, bathroom fixtures, toilets, phones and keyboards, tablets and bedside tables every single day. That's a good one, Francis.
All right, so just some tips from the National Institute for Communicable Diseases. It has released as well a new hotline for clinicians. This is only for doctors: 0800 111131, 0800 111131, but only for doctors.
Right, so in addition to that, the next number, 0800 029 999, 0800 029 999. The public can also contact the public hotline number on 0800 111 132. So 0800 111 132. You'll find all of that at the bottom of the screen there.
So 2 numbers, phone, specifically if you feel that you may have coronavirus. We take a short break, lots more coverage to come. Stay with us on The Full View.